Hi everyone, I hope you all had a good summer. My name is Christine Van Vliet, and Megan Fisk and I are working together on our project, which is immersion bathing for newborns. Our PICO statement is, will a pilot test of delayed immersion bathing result in a practice change for our facility? So Megan and I, we decided that this was an important project for several reasons. I am the manager of labor and delivery at L&M Hospital, and recently this summer I also picked up the NICU. We've undergone some leadership changes during this past summer at L&M. One of them includes my director, who she was pretty involved with what the project was going to be at that time. So we've had to kind of just regroup, and I have a new director. She's on board with it, but we are a little delayed in our timeline that we thought we would have a little more implementation done at this stage. The other piece of it is we also got a new infection control lead for L&M, and she is amazing. So she's been having some other fish to fry, so I'm hoping to have her full undivided attention this week when she gets back from vacation. So in the meantime, Megan and I, we have surveys out, and some of the survey questions, so this is part of our validation for our implementation. So I have a survey with 5 questions, and the questions for the parents are: have you ever bathed a newborn baby prior to admission? After your baby's first bath in the hospital, do you feel that you were prepared to bathe your newborn at home? Would you prefer to bathe your baby or have the staff bathe your baby for you? And do you believe that delaying your baby's first bath is important for his or her skin? And the last question is bathing your baby important to your birth experience? So what I've noticed so far is that some of the patients really want the nurses to bathe their baby. They're afraid of the baby. So they want that support, and they want someone to be there and show them exactly what to do. Some people are more hands-on learners, and they would much prefer to bathe their own baby with the nurse standing there telling them what to do. Some people, this isn't their first baby, so they're very comfortable bathing a baby, or they're not comfortable because they had their baby 13 years ago. And some people don't want to be involved at all in the birthing experience, want to be on their phone and either updating Facebook or videotaping their baby. So that's what we have so far. We're also keeping a temperature log and this is kind of how we do it in our current state, is we take the baby's temperature to make sure the baby's warm enough to take, for the baby to have a bath. So we measure the baby's temperature, and with the warmer's temperatures to make sure it's warm enough for the baby to go on, to be in a warm place for the baby to get bathed. The difference with immersion bathing is we're going to have the baby immersed, except for the baby's face will just be out, and they'll be immersed in the bathtub. And it's also really not to wash the baby, it's just to kind of get off that the vernix. The vernix is there for protection of the baby, so we don't want to really scrub that all off the baby. It's not good. So we just kind of want to wipe off the baby gently in there. The bath is meant to take a few minutes, and maybe wash the baby's hair if there's a lot of vernix or blood, or if the baby had meconium. There are some babies who are going to be excluded from this pilot, and those will be the babies that maybe have meconium aspiration, HIV babies, Hep C babies, any baby with respiratory issues or blood sugar issues. They will not be part of this because they don't usually get their bath until they're medically stable, and HIV and Hep C babies need to get their bath immediately after delivery. So going back to our project and the description, our current best practice recommendations for newborn bathing, according to AWHONN, which is the Association of Women's Health Obstetrics and Neonatal Nurses, Wait for 8 campaign, which was initiated in 2013, is to delay bathing the newborn. AWHONN recently demonstrated that a delayed immersion bath was the most beneficial in decreasing hypothermia in newborns, increasing rates of breastfeeding, and increasing parental involvement. So those are all key things for our newborns. Immersion tub bathing has been AWHONN's recommendation for practice since 2001. I honestly don't think that there's many hospitals in the state of Connecticut that do immersion bathings. I think that we will be one of the first ones to do it. I know when we talked about this project several months ago, when we implemented the delayed for 8 practice on our unit in January, we also at that time wanted to do immersion bathing. So my staff does have some education on that. Our barrier at that time was infection control. So we have those purple wipes, which I'm sure many hospitals have those purple wipes, and we use those to disinfect everything on the unit. When we were going to use the purple wipes to clean the tubs, we realized that some of the ingredients in the purple wipes are actually neurotoxic to our infants. So that had to stop our process. We also had to find the right tubs. We found a tub. One of our staff members were going to be our guinea pig for the immersion bathing, and her baby was like 6 pounds. So this tub was like for like a 3-monther, and it was really big. We were going to lose the baby in there. So in the meantime, our lactation consultant and the breastfeeding task force worked really hard to get tubs that are appropriate size for the baby. And I have a meeting this week with our infection control, our new lead liaison. Like I said, she's very amazing, and I'm sure she'll have a lot of great information for us. So after I meet with Donna, the infection control person, Megan and I plan on implementing this pilot the week after. Because our timeline is so short, because it's a 7-week class, we want to really try to get our pilot out by the week of the 10th, so we could pilot it for the week and then see how long, if we're able to sustain it, which I think we will, because our nurses, while we are going through several changes, we're also getting nitrous at the end of the month. We're getting something called the Monica Newby, which is a electric fetal monitoring system that the women can actually move around the unit a lot more. They can be free to walk around. They can go in the shower. We're getting a tub this month. So there's a lot of changes. So sometimes that can go either really well, the timing might be perfect because they're getting so many changes anyway, or they might be like on change overload. But because this isn't new information, I'm thinking that we're going to have a positive feedback from both the patients and the staff on this. So I think that's pretty much our project where it stands right now, and what our PICO statement again is: will a pilot test of delayed immersion bathing result in a practice change in our facility? I think that it will. I'm very hopeful about this project. I think Megan and I work really well together. So I'm looking forward to wrapping this up this semester. Good luck, everybody.